Warning signs you're deficient in biotin. The skin is a window to what is going on internally. In today's video, we're going to be covering the dermatologic findings, the hair, the skin, the nail changes that suggest you might be biotin deficient. Biotin is an essential micronutrient. It is a B vitamin commonly referred to as vitamin H. Human tissues don't make biotin, however, bacteria that live in the large intestine can produce biotin, and it's readily obtained from our diet. It's found in fruits, vegetables, nuts, seeds, legumes, whole grains, meats, fish, and dairy products. Biotin is an essential cofactor for enzymes known as carboxylases, which are really important for things like fatty acid synthesis, gluconeogenesis, the expression and control of different genes. Biotin deficiency doesn't just affect you all at once. Its onset, in terms of symptomatology, is gradual in onset. But again, the skin can be an early warning sign. So what are some warning signs that you are biotin deficient? When it comes to the skin, hyperesthesia, heightened sensitivity to light touch. Maybe you notice that when your hair brushes against your face, it feels uncomfortable. Conjunctivitis or red eyes, kind of look like you have pink eye. And glossitis, which is the medical terminology for an inflamed, red, swollen, painful tongue. Now, if you've watched any of my other videos on this channel with regards to the skin signs of various micronutrient deficiencies, you'll know that glossitis is a common finding. So it's not specific to biotin deficiency, but it certainly can be found. All right, probably what biotin is most well known for is how important it is for healthy hair growth. If you are biotin deficient, you can expect to experience thinning of the hair and gradual hair loss, not just from your scalp, but from the rest of your body as well, including sparse thinning lashes, brows, and eventual total body hair loss if allowed to progress untreated. Biotin is also important for healthy nail growth. People who are biotin deficient develop very brittle nails with splitting of the nails. Biotin deficiency leads to a characteristic facial rash. It is periorificial in location, meaning it occurs around orifices, like around the mouth, the nose, and the eyes. This rash is scaly, flaky, and dry in appearance, sometimes easily mistaken for seborrheic dermatitis. It can become more widespread and involve the skin around the anogenital area. Sometimes it might also look like psoriasis or the dry skin condition ichthyosis. As with many other nutrient deficiencies, it is not uncommon to develop dry, scaly, flaky skin in general with biotin deficiency. Because the skin becomes dry, flaky, the barrier is impaired. Again, you don't have optimal function of those key enzymes. You are more predisposed to skin infections with different fungi and yeast. So you may develop candidal yeast infections in the skin folds readily as a result of your biotin deficiency. Check out my video on signs of yeast infection on the skin to go into more detail with what those might look like. Outside of the skin, hair, nail, and mucous membrane warning signs of biotin deficiency, you can also start to feel, well, generally quite unwell and have neurologic problems such as seizures, brain fog, depression. Many patients with biotin deficiency also have muscle aches and pain. These are non-specific, but definitely can go along with biotin deficiency. While these findings can occur with biotin deficiency, they're not necessarily super specific, and so you might be freaking out looking at your seborrheic dermatitis on your face, worried that you have biotin deficiency. So who exactly is at risk for biotin deficiency? This may come as a surprise to you, but a group of people who are at risk for sure are the individuals who rather enjoy regularly consuming raw egg whites. Uncooked egg whites, when ingested on a regular basis, I'm not just talking about once or twice here and there to be cool around your friends. I'm talking as part of your regular diet, consuming raw egg whites can easily lead to biotin deficiency. The reason for this is that raw egg whites contain a glycoprotein known as avidin, which binds to biotin and affects its absorption. Fortunately, when you cook egg whites, this denatures the avidin, so it's not an issue. Patients who are in the hospital and have to be placed on a type of nutrition known as total parenteral nutrition. These patients are at risk for a variety of nutrient deficiencies, including biotin, if not properly addressed. Anytime I do a video on the warning signs of any sort of nutritional deficiency, I always have to bring this up, but a group of people who are at risk for all sorts of nutrient deficiencies are individuals who struggle with chronic alcoholism. Alcohol specifically inhibits the absorption of biotin. It's not uncommon for patients who chronically abuse alcohol to have low biotin and put themselves at risk for biotin deficiency, as well as a whole host of other B vitamin deficiencies. In fact, plasma biotin concentrations are low in about 15% of patients with with chronic alcoholism. Pregnant and breastfeeding women are also at risk for, well, low biotin, I should say. As a matter of fact, many pregnant women have low plasma levels of biotin. Plasma and breast milk concentrations of biotin also can commonly be low in lactating women. So if you are pregnant or breastfeeding, make sure you discuss with your obstetrician regarding optimal nutrition and if you need to be supplementing with biotin. Then there are certain medications that can interfere with biotin absorption or enhance its metabolism, making your biotin levels low. Specifically, medications used to treat seizure disorders such as carbamazepine, phenytoin, phenobarbital, primidine. Anyone who has an underlying malabsorption problem, whether that be related to some sort of surgical resection, a part of their digestive tract, or an underlying medical condition that makes it difficult for them to absorb nutrients from their foods, they're also at risk. And then there are 3 very rare genetic conditions that lead to biotin deficiency. But if you had that, you would know those are usually diagnosed when you're a baby because, well, they have serious consequences to being left untreated. This is one of the most important takeaways from today's video, is that biotin deficiency is actually super rare. Unless you're consuming large amounts of raw egg whites, unless you struggle with alcoholism, unless you have a very rare genetic condition, it's very uncommon to have biotin deficiency. It is readily obtained from our diet. If you are eating, provided you don't have some malabsorption syndrome, you are unlikely to be biotin deficient. It's very, very unlikely. What's more likely is that you have hair loss related to age, or you have seborrheic dermatitis, which is common. Check out my videos on it. Or you have brittle nail syndrome, which commonly affects middle-aged women. All right, that's great, but should we supplement with biotin? Will it actually help us out? There's not really good research to support taking biotin supplements for hair, skin, or nails, despite the fact that biotin supplements and hair, skin, and nail vitamins are widely available, heavily promoted, and heavily sought after for that matter. There is a small bit of research that suggests that biotin supplementation might be helpful for the brittle nail syndrome. However, more research is needed. Whoop-de-doo, why not just take biotin regardless? Well, biotin supplementation actually can be pretty harmful. Why? It can interfere with certain blood tests that your doctor might order to check for certain things. Biotin supplementation has actually led to false positive results, meaning the lab test says you have a disease you don't have. Also false negative tests, meaning the lab test says you don't have a disease that you actually have. Why does this happen? Well, when your doctor sends your blood to the lab to be tested for certain things, there are different ways to test the blood, and certain blood tests utilize a technology known as biotin streptavidin. It's an immunoassay. But if you have very high levels of biotin in the blood, it can interfere with how this particular test works, resulting in either falsely high or falsely low lab values. What are some examples of lab tests that can be affected by taking biotin? Test to check thyroid hormone, test to check vitamin D, a test known as the pro-BNP. This is a test that might be ordered in the hospital to check to see if you are in congestive heart failure. For example, taking 10 milligrams of biotin within 24 hours of having your thyroid test taken can screw up the test. And you may be thinking, well, I'm not taking 10 milligrams. How big of a deal can it be? Keep in mind, they sneak biotin into a lot of things these days. I notice it's in a lot of beverages, sport drinks, energy drinks, etc. There have actually been case reports of people diagnosed with Graves' disease when they don't have Graves' disease because biotin screwed up their thyroid tests. And also, super scary is the fact that biotin can interfere with the blood tests that are run to check to see if you're having a heart attack. In fact, there is one case where someone actually died of a heart attack, and their lab tests were showing that they didn't have the concerning findings for a heart attack because the biotin interfered with a test known as a troponin. So if you are taking biotin, it's suggested that you stop taking it within a week of having your blood drawn in order to avoid having it interfere with the accuracy of these blood tests. And of course, make sure you tell your doctor that you are taking biotin, alert them that you're taking it or that you have stopped taking it in advance of your appointment so that they know that and know that it might influence the lab tests. Here's the thing though, I don't know about you guys, but I don't really plan out when I'm going to have my heart attack. I've never had one. I hope I never do, but it's one of those things that we generally don't pencil in on our calendar. So how are you going to know to stop your biotin supplementation in advance of having a heart attack? You're not. So in my opinion, biotin is one of those things that is way overhyped. The research supporting us taking all this biotin is just not there. There's no good evidence that it really solves any common existing problems, aside from, of course, patients who are the exception that do in fact have biotin deficiency. On the flip side, rather than solving any problem, it is well established to cause a problem, meaning inaccurate, false positive, or false negative blood work, which can be quite dangerous. It might result in you getting falsely diagnosed with something, it might result in a misdiagnosis, or it might result in you, well, having to go through more lab testing, more expensive testing. And in today's day and age, that can leave you, well, frankly, bankrupt, because medical care ain't cheap, at least here in the US. All of that unnecessary stress can end up, well, impacting your hair growth and leading to a telogen effluvium, excessive hair shedding. All right, guys, those are the warning signs of biotin deficiency. Biotin deficiency is very serious and can be life-threatening if left untreated. However, it's super rare. So think about that before going after those biotin supplements, because they might end up harming you rather than helping you. I hope this video was informative to you guys. Now, on the end slate, I'm going to put one of my more recent videos on more warning signs of an underlying micronutrient deficiency, so check that video out next. But if you guys like this one, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye!